Did you know that not all types of dementia are Alzheimer's disease? In fact, the second most common type of dementia is called vascular dementia. And understanding the difference can help you recognize symptoms early and potentially slow the progression. Hi, my name is Bailey Hillman. I'm an occupational therapist and a nursing home administrator. I specialize in dementia care. And if you're wanting practical, evidence based tips to better understand dementia and take care of your loved one, make sure to like this video, subscribe to this channel, and turn on your notifications so you don't miss any future videos. Today we're talking about vascular dementia. What is it? How does it occur? How is it different from Alzheimer's disease? And can you potentially have both Alzheimer's and vascular dementia? So let's dive in. What is vascular dementia? Think of your brain like a neighborhood. Every home needs roads to get water and food and supplies. Your blood vessels are the roads in your brain. In vascular dementia, those roads or blood vessels become damaged or even blocked. And that means that those parts of your brain are going to not get the oxygen and nutrients that it needs. And then over time, those cells are either going to be injured or potentially die, which then will cause changes in your memory or your thinking or even your daily function. The damage can happen after a major stroke or even smaller strokes. It may actually even occur over years and go unnoticed if you have high blood pressure or high cholesterol or even diabetes or if you're a smoker, because all of these things will damage the blood vessels in your brain. A common question that I get is, can you have both Alzheimer's disease and vascular dementia? And the answer is actually yes. In fact, it is very common for someone to have both Alzheimer's disease and vascular dementia. They call it a mixed dementia. Alzheimer's disease causes abnormal protein buildups in the brain, while vascular dementia is going to cause that reduced blood flow to the brain. When both conditions are together, you may actually notice symptoms a little bit sooner, and the symptoms are going to progress a little bit differently if you had vascular or Alzheimer's disease by itself. So, what are the symptoms of vascular dementia? Unlike Alzheimer's disease, where we typically see short term memory loss first, with vascular dementia, we're going to see problems often starting in their executive functioning. That means that your loved one may have problems with planning their day, or even problem solving simple things, or making decisions, or staying focused, or even potentially processing information a little bit slower than they used to. Memory can most definitely be affected. However, it may not be the first thing that we notice. So you may also notice things like confusion or trouble walking or balance issues or even mood changes or apathy or depression or difficulty even completing familiar tasks. One thing that's very unique about vascular dementia, unlike other types of dementias, is that it's going to get worse in a step-like pattern. So instead of a slow decline like Alzheimer's disease, someone may actually stay the same for several months, and then all of a sudden you see them worsening because they may have had another stroke or another episode that has reduced that blood flow to the brain. A common question that I hear is, can it be reversed? And unfortunately, the brain damage that's already occurred because of the lack of oxygen or nutrients to the brain cannot typically be reversed. However, there is some good news because you can manage the conditions that have caused the initial event, the vascular event that occurred, and you could slow any future potential decline. So, how do you do this? Well, you can lower your blood pressure, you can manage your diabetes, you can lower your cholesterol, you can stay active, eat a healthy diet, take your medications as prescribed, and stop smoking. Remember, what's good for your heart is also very good for your brain. If you or your loved one has been diagnosed with vascular dementia, remember that every person is going to progress differently. Some symptoms may progress slowly, while others, after a potential health event or another stroke, can change quite quickly. The more, though, that you understand of what's going on in the brain, the more you're able to better be prepared to take care of the person who you love. If you found this video helpful, make sure to share it with other caregivers, and don't forget to like and subscribe because you don't have to do this alone.